This morning there was a lot about, how to make the diagnosis. And then the next step is after the diagnosis, now what? You have the patient, you have the family member in your office, you've told them what they have, now what do you do? And I can't stress enough how important I think it is to have someone there in the room. You have to connect with the caregiver. You can't make a diagnosis without having someone else give the information. I also work half-time at the Alzheimer's Care Center, and not too long ago we sent a lady who had a fall to the hospital. She went into the ER and got admitted. The next morning we looked in her EMR chart to find out what was going on, and it said this is a lovely 84-year-old lady, lives independently in her own apartment, does shopping, drives, takes care of herself. Am I not? Oh, okay, I'm sorry. Okay. So it's really, really important to talk to someone else besides the person who you're interviewing. So once just for some numbers, there's 37,000 people in Maine who have Alzheimer's. 1 out of 7 of them live alone. About 5% of people over 65 in Maine live in an institution. So there's many, many, many people at home. Most of the care nationally is given by female spouse, female daughter, or female daughter-in-law, and that's nationally. But there's also children, sisters, brothers, ex-husbands. We've seen an incredible combination and group of caregivers, and even the enforcement officer. We saw brought in a gentleman, and he was called to his house because his house, I guess, was a mess. He took him on, and now is his primary caregiver. Another source of caregiver, sadly to say, are often mothers and fathers. We have 2 people at the Alzheimer's Care Center who have living mothers and fathers who come to visit them. And I think we had a 53-year-old man in our adult day program whose 84-year-old father would come every afternoon to pick him up and had to help him on with his coat, help him on with his gloves, help him on with his hat. I think there is really nothing more sad than seeing a parent care for their adult children. So the caregiver combinations are enormous. There's often children who have been sexually abused by the parent, verbally abused, physically abused, but for some wonderful reason they are still willing to take care of them. The burden of caregiving, and this is national, is 92 hours per week is what is the hours of care that they give to someone who's demented. It's 62 hours per week for the non-dementia. The caregivers of people who take care of people with dementia feel much more negative, they feel exhausted. It's really oftentimes a thankless job because it's the caregiver who really gets the anger, gets oftentimes the aggression. The person, they see that person taking their independence away, telling them no, they can't drive, no, they can't go outside. And they're the ones, it's really a thankless job. And many times I've heard people say, it'd be so much easier if he had cancer. it'd be much easier to care for him because you're not thanked for your kind work. Caregivers are at great risk. They're at risk for depression, they're at risk for alcohol and drug abuse, and this is all national. There's been a lot of studies done on caregivers, and these are the risks. Someone who is taking care of a spouse all day, really at the edge of, at the edge of it, and the person with dementia goes to bed, think, oh, I'll have a drink, I'll take a sleeping pill, I'll take two. That is something that is fairly common. A great risk for anxiety. Because it's new, people don't know what to do. This is the first time often that they have cared for someone. They don't know if it's doing it, they don't know if they're doing it right. They don't know what to expect, and it can cause great anxiety. Isolation. People oftentimes who were very active socially, maybe went to church every Sunday, golf, played bridge, went out with friends. As the disease moves along, people withdraw. Not only the person with dementia, but the caregiver withdraws from things. I don't want to go to church anymore because he acts out in church. I really can't leave him too long. He doesn't want me to go. He gets angry. All those things. I always encourage people to keep doing all the things that you always had, because you really need to get out and away. And all of this has a negative impact on overall health. So I think it is important that you make a very close connection to the caregiver, because the patient, after a while, is not going to be able to tell you what's going on. The caregiver becomes the voice, and not to compare people with dementia to children, but if you have a 2-year-old or a 3-year-old in your office, you certainly would talk with them, but it's really the mother or the father that can give you the history of what's going on. Sometimes I've had to accompany people to the ER when they've had to be sent from the Alzheimer's Care Center, and they're in there, and the nurse or someone will come in and say, well, where does it hurt? They aren't there because they fell on their hip. We're quite sure it's a hip break. They ask the person, what hurts? And they'll like, well, it's up here and it's over here. I mean, you really have to have someone else there. The caregiver, it is that voice. What do they want from you? They want to be involved. So many times people say, gee, I can't get in to see him, or, he won't talk with me. I always suggest that the family, if they have concerns, write a letter and just say, these are the things that I have noticed, and just be very clear. And at least that way, you'll have a heads up, and that might make you look further, because I think sometimes when you see somebody for 10, 15 the minutes, hi, how are you, fine, good, they seem fine, but families often see other things. They want to be informed. They want to know what's going on. They want to know that they have someone that's going to walk with them throughout this journey, someone that they can consult with, someone that they can call. They themselves want to be cared about. They need to ask, how are you? How are you doing? And this is also the time when you might pick up possibility for abuse. And I'll often ask people, I'll be interviewing a family, and the husband might say, "Oh, I just get so mad when she does that," da, da, da. And I'll feel very comfortable saying, "Do you ever get so frustrated that you feel that you might want to hit her?" And if he says yes, I'll say, "Well, have you ever?" To pick up that, because it is a very frustrating thing. I think picking up financial abuse and those kind of things are a little bit more subtle, but I think being aware of the caregiver's frustration level is really, really important. What they will usually ask you, after the diagnosis, they'll want to know how long they're going to live. They'll want to know if they're going to wander. They'll want to know, will he become violent? Will he become aggressive? They'll want to know when he will have to give up driving, or when will it be where he isn't safe for me to leave him alone? When will he not know who I am? Oftentimes that's the mark for people to say, it's time to have them live somewhere else, when they do not know who their caregiver is. When will he need institutional care? That's a question we get all the time. And because there's no crystal ball, there really is no answers, because everybody is so different. And you can set up a perfect care plan. You can have a homemaker in 2 hours in the morning, and you can have them go to adult day 3 days a week, and you can have this really lovely care plan, but you can be sure within 6 months it's going to need to be tweaked. It's going to need to be changed, because the disease can, as you know, continually get worse, and needs continually change. So what might work for 1 month, 2 months, 3 months is not going to work later. So there was a study that was done of 500 physicians, and it said that their greatest need was handling the problems, managing dementia, including the family issues. That rated as one of the most difficult clinical problems that they encountered. And the calls that you will probably be receiving is not about the flu, or not about an elevated THS, or not about medical issues. It's going to be behavior issues. It's going to be the crisis call that he's being aggressive, he's got guns up in the bedroom, he found the car keys and he's out in the car. It's those crisis calls that people more, I think, apt are going to be calling you for. Oftentimes they will be looking for medication for sleep, looking for medication for aggression, looking for medication for wandering, of which I don't think anything works on that. But those are going to be the issues that I think people are going to be looking to you for, not so much the medical. Okay, I've broke up resources into 4 sections. The first one is information, education, and support. And just to say, I wish I could say that we have in Maine a wonderful, comprehensive, fully welcoming system of care, but unfortunately we don't. We do have some things in place, and I will talk about those. Support groups. Now, this information, education, and support are quite readily available, and they're usually free. Support groups usually meet once a month. We have like 4 at least that I know of in the Waterville Augusta area. Support groups aren't for everyone. Sometimes you'll say to a person, well, you know, there's a support group. Well, I don't want to go and hear a bunch of people whining about their problem, you know. But, you know, they are for some, and there's been wonderful support that people have gotten from each other, and friendships form. So I think it's something that should definitely be offered and encouraged. The Alzheimer's Association, and we'll hear more about this, has a 24-hour hotline that people can call 24 hours a day, 7 days a week for anything, information, crisis. I'm awake, I don't have anybody to talk to, but they are there on that hotline. The Savvy Caregiver class, it's a 12-hour, 6-week class, and it gives a lot of really good information. Things that, you know, how to tell fibs, you know, how to let things go, how not to argue. Argue and trying to explain to someone that no, you're not in Florida, only escalates behavior. And these classes are very, very helpful in going through real issues that happen every day when people get agitated, when they want to go home and they're in their home forever. They really give helpful hints of what to do, what to say, what not to say. And again, these are all free and readily available. The Savvy Caregiver class is given all over the state of Maine. Support groups are all over the state of Maine, and then the 24-hour hotline is always there. Resource number 2, home care and respite care. This is, I think, more complex. To get a homemaker, to get a home health nurse, to get a personal care assistant in the house is a very complex system to go through. There's, you know, many programs, but each program has their own income criteria. They have their own activity of daily living criteria. One program you can have 10,000, another one you can have 4. You can't be in 2 programs at the same time, so you can only have one. It's very complicated. The bottom line is, if you have money, you can get services. You can hire homemakers, personal care, 24 hours a day. If you have Maine Care, you can often get a good array of services. But for those people in the middle, and unfortunately, I think some aspects of the state of Maine is really into, you know, they don't want people to have too much. So it's very, I find it very hard to get, there's waiting lists for many services. The adult day service, there are many of them in Maine. They're certainly not in every community. That has some funding from the state. Sometimes there's a waiting list for it, sometimes not. That is a wonderful program, and it's primarily, I mean, it is for the person who has dementia, but it's really primarily for the caregiver, because it gives them the opportunity to be in their own home without the person being there. And a lot of people do not want strangers in their house, and they're very reluctant to hire someone to come in and help, because that often means if someone is hired to come in and say help someone shower, the caregiver feels like they have to leave because the person isn't going to interact with the person there to help them shower. So if they have someone in the home, they often feel that they have to leave. So the adult day, you can drop them off at 8, pick them up at 5:30. Some people stay and eat. Many of the daycares bathe, change their clothes, do their laundry. It's a great service. There again, it's not for everyone. Oftentimes, I'll always mention it, but people have to say, "Oh, my father, he was never social. He wouldn't like that kind of thing at all." And then they'll say to him, would you like to go to adult day? Well, of course, the answer, there's no. What I say is don't ask them. Just say, someday, let's get in the car. We're going to go meet some friends of mine I want you to meet, have some coffee, and then they'll kind of adjust. And the thing that we have found that people absolutely do not want to go, but if they go steadily for 1 week, they really look forward, because they when they walk in, they're greeted with open arms. "Oh, Mary, I'm so glad I need your help. I mean, we're going to be doing this. I've got all this thing." Most of the people who go to our adult day program think that they work there. I mean, we've even had to go to the extent of writing checks, because they wanted to be paid. And that's a great thing. And it's sort of, they'll say, well, while you're here, because you do so much for us, we're going to give you a spa today. I'm going to do your hair, and you're going to get in the whirlpool, and that's because you're so helpful. So that is a great program. The next resource is technology, and we've had Lifeline for a long time, but there's this other thing that's really neat called the Philips Lifeline pill dispenser, and it's hooked on to the phone, $30 a month. It can dispense pills up to 40 days, and what it is when it's time for the pill, somebody has to set it up, but they can set it up for 40 days. When it's time for the pill, the phone says, "Mary, it's time for your medication." So, and then if the pill isn't taken within an hour and a half, someone who's ever on the list is called, and it only dispenses it again if the first one is gone. So that seems to be, especially in early on, medication compliance is a big problem. They may take more than they should, or they forget. And families sometimes can call once a day, and they'll stay on the line. You take your pill and let me know when it's done. But sometimes when people get pills morning, noon, evening, it's really hard to monitor that. So I think this is a good service, and it's not terribly expensive. There's a group in Tamascata called Full Circle America, and it's run by a physician named Chip Teal. And he has many things, but one of the things he has is that people can install cameras in their home, and they have someone monitoring those cameras 24 hours a day, so they can see, is a person taking the pill? Are they up? Have they fallen? And if someone has, they make a call, and someone goes to the house. So that, some people are a little hesitant about cameras in the house, but I think it could be very helpful early on. Clearly, as the disease moves along, the pill dispenser, the Lifeline, those things are not going to be helpful because they're not going to know how to operate it. There is an app you can get on your phone that also has cameras in your home, that you can have one in the bedroom, one in the kitchen, one in the living room, turn it on at any time and see, are they up, are they eating, are they seated. The Lifeline, sometimes when people have gone beyond, oftentimes we'll have people come in who do have Lifeline, And one of the questions we always ask, oh, what's that? And they'll say, well, it's, I mean, when they say it's a necklace I got from my grandson, you know it's beyond being helpful. Because, you know, there does come a time when people just don't remember they have it or remember how to use it. But these things for early on can be very helpful to keep people living at home as independent as they can. And for those people living alone, I mean, there's a lot, I mean, 1 out of 7 people with dementia are living alone. So that's, the next is long-term care. Assisted living, 46% of the people in assisted living in Maine have some type of dementia. In order to be in an assisted living, people have to be able to walk on their own, get in and out of a chair on their own, in and out of to bed on their own, and feed themselves. Once they get to the point where they need hands-on help, out of a chair, in bed, out of bed, or need to be fed in the course of a week, one time, then they are nursing home eligible. And that's when they have to go to the next level of care. 58% of people have dementia in nursing facilities in Maine. But again, Maine, I think, at least it was, had lower than the national average of people in nursing homes. I think the national average is about 7.5%. Maine is about 5%. You've all heard of Gould, the Gould assessment. I think the Gould causes a lot of, I mean, we have people call our nurse, Sandy Taker, and say, well, you know, I want to have my mother go to a nursing home, and they said I have to be seen, I have to have an evaluation. They often mistake Gould assessment with geriatric assessment. It's very confusing. It's called Gould Healthcare Systems, and they are under contract with the state of Maine to be the gatekeeper for long-term care. So if someone is going to be Maine Care and they are going into a assisted living or nursing home, they have to have a Gould assessment. And a Gould assessment is done by a RN. It's all over the state. They come, they have computers on little suitcase rolling things. They come in and do the full assessment. It's really important that family or somebody is there, because we've had many Gould nurses go into a person's home to do an assessment, and you know, it's the questions, oh, do you cook? Oh yeah, sure, I cook. Do you clean the home? Yeah, I clean the house. You have to have somebody else there, because that is not what's going on. So it used to be, years ago, to doctors, if they said you need a nursing home, that was it. 1994, they started the Med in 94. That was the first assessment. Now they have Gould. They are the ones that say if they can go to that level of care. There again, if you're private pay, you can go anywhere you want without Gould. So that is the fourth resource. I'm not going to give a list of everything, but the other thing is I don't have a learning objective, but what I would hope the learning objective would be to you is that to know that there are services and support and resources out there, and just getting that information. Not every single program, not every thing that's available, but getting the person that you just diagnosed to the right place where they can get assistance in walking them through really this quite complex system. And now I want to introduce, we have asked Liz Crawford from the spectrum generation, and Bill Kirkpatrick from the area, from the Alzheimer's Association. They are statewide agencies. There's 5 area agencies on Maine. Liz is from one. She is a caregiver specialist. Every area agency on Maine has one. So those up in eastern Maine, northern Maine, everyone has a Liz. The Alzheimer's Association is a statewide agency. So someone from Fort Kent can call and get help and services. So that's why we've asked Liz and Bill to tell you when you refer, when you give a family member their name, their number, exactly what will happen and what can they do for them. So Liz is going to speak first.
Well, Jane did an excellent job of describing all of the things that we do. So as she said, there are 5 area agencies on aging throughout the state. There are also area agencies on aging throughout the country, and all of us have family caregiver programs. And I think that's important to note in case you happen to be working with someone whose son or daughter lives out of state, and the son or daughter maybe calls you and says, I don't know what to do. You can then refer them to their local agency on aging. Many of you may know that some of the programs that we're kind of well known for, like Meals on Wheels, we have resource counselors that can help people with questions they may have about Maine Care and Medicare, things like that. As far as the family caregiver program is concerned, when people call our agency, Spectrum Generations, they end up with me. And basically, I can get people connected with other resources that may be helpful to them, some of the ones that Jane talked about. Also, there are other things like there are memory cafes offered throughout the state that we can tell people about. The respite programs, some of the respite programs that Jane mentioned, all of the area agencies on aging have a respite program, and I can explain how those work to people, as well as when people just don't know what their next step is. People have heard of Gould, but they don't know what that means to get a Gould assessment, or they feel like, I might need to look at placement at some point, but they don't even know where to begin. I can really help walk people through that. The other thing is that a lot of times when people get in touch with me, they end up sort of developing a relationship with me. We offer, in our agency, we offer 6 support groups throughout the month. All of the other agencies do as well. I facilitate a lot of those groups, so people may call me and be looking for support, and then I say, would you be interested in a support group? Like Jane said, some people absolutely not their cup of tea. I will say that for me, as a facilitator, the support groups are probably the favorite part of my job. Sometimes they can be tough, but they can be really funny too. It's a really good place where people can come and talk about the things that are driving them crazy and have other people that understand. So they talk to me, they come to a support group, they meet me, and then they can still call me when they have other questions. Things that they might not call their physician about, but things that are really tough for them at home. As Jane was talking, I remembered a gentleman that called me one day and was really frustrated with his wife. She had been reading the newspaper for 2 hours. Now, this was a gentleman who comes to support groups, he's done the Savvy Caregiver class, he has a relationship with me. So he called and was just so frustrated. My wife's had the newspaper for 2 hours. She put it down, and then she got in a big fight with me because she said, why didn't you give me the newspaper yet? So in this conversation, she gets on the phone, who are you talking to? And it was this whole big issue over the newspaper. And I said to him, so what if you had just said, oh, I'm sorry, I'll get that for you? And it was just that light bulb moment of, oh, kind of like Jane was saying, we call them therapeutic fibs, that just kind of going along. Simply saying, oh, I'm sorry, I'll go get that newspaper for you, would have relieved a lot of stress in that household that morning. But when you're in the middle of it, it's really hard to think that way. So people can call the Family Caregiver program and just have those conversations. And like I said, we're there to get people connected with resources and help them understand what this process is all about. Jane also mentioned the Savvy Caregiver program. Again, it's a 6-week class. It's an evidence-based class that we offer throughout the state, and that's been going on for a number of years now, and it's really well received, and people really get a lot out of it. It's great for people in the early process of caregiving, because we talk about the disease process, what it's going to look like, how to handle behaviors, how to keep people content and involved, as well as we talk about some resources, and we really, really make a point to make sure that caregivers are taking care of themselves. So that's, the big takeaway point from that class is keeping your person content and involved, and also making sure that caregivers are taking care of themselves. Like Jane had some of the statistics about caregivers can end up in pretty rough shape throughout this process. And the other thing, just to mention too, as far as the AAAs are concerned, we offer a wide variety of programs. At Spectrum Generations, we have day programs, and I'm familiar with all of those things. So when people call me, I know firsthand what those programs look like. And the same for the other family caregiver people. We're out in the community, we're visiting places, so when people ask us or have questions about, well, what's it going to be like if I take my dad there? What's this going to look like? I can really help them through that process and help them to understand that. So, I think, Bill?
So the Alzheimer's Association is the world's leading voluntary health organization to provide this kind of, this level of resources and support for people living with dementia and their caregivers, to reduce the risk of dementia through the promotion of brain health and to support research, of course. We have a number of programs and services, and the table out there, a number of people stopped by to pick up brochures. So just in terms of the context of providing support to primary care practices, but also all levels of resources and services in the community, our job is to help you help your patients who are living with dementia and their caregivers be able to navigate and live with Alzheimer's or another form of dementia, find the resources necessary to be successful as they navigate the system and as they deal with communication or behavior issues, and also, very importantly, plan for the future. We know that you don't have a lot of time to do that in your offices. And so there are real quick tips here in terms of handoffs that are effective both to the AAAs and also to the Alzheimer's Association. We work together in many of these programs. So I want to kind of quickly go down the list here. Jane referenced our 24/7 helpline. That's our national contact center that's located in Chicago. And although you could call my office in Scarborough and talk to me, it would be between 8:30 and 5 Monday through Friday. So we advertise our 800 number because if you're living with dementia or if you're a caregiver dealing with sort of a distressful situation or a crisis, you need to reach somebody live whenever that may be. It could be 2 o'clock in the morning or 8 o'clock on Saturday morning. So this resource is for people living with dementia, their caregivers, but it's also for you as well. It's accessible to professionals who need a consultation. It's staffed by masters, prepared clinicians. And if someone from Maine calls that line, we receive daily reports. So the next business day, when we take our contact center report off, if we see someone from Maine called, we will follow up with a phone call and an offer of additional resources and services. So people living in Maine will hear from a Maine-specific or local resource. So the helpline really provides 2 levels of care: information and referral. It could be very basic. I need to find a physician for a workup. or I need to find a Savvy Caregiver class or other kinds of resources. And then we'll follow up that conversation once we get a sense of what the needs are and mail out a packet of information that has an array of resources. The website is a valuable resource. On the table, you can pick up our chapter bookmark that has our 800 number, but also alz.org/Maine, which brings you to the website. We organized all of the resources in Maine relevant to care and support by county, and so you can click on Kennebec County and get a full array of resources, including all of the assessment centers, geriatricians, neurologists, elder law attorneys, support groups, and the full array of resources. We'll often send that kind of resource as well. I want to refer back to Cliff's, Dr. Singer's second slide, in which he referenced why diagnose dementia. And a lot of those kinds of, the answers to those questions really come up in our care consultation, which is the next level of our helpline services. So the care consultation refers to the experience of spending time that it takes to talk to someone, either because they are living with dementia, they may have just gotten a diagnosis, they may be worried about their memory, or they may be dealing with a driving related question or anything else. And what we do is to delve much more in detail and have a more deeper conversation. And we're able to do that in person in our Scarborough office and in a couple of remote areas we've just developed. And the purpose of the care consultation is first, of course, understand what the presenting issues are, and then begin the process of evaluation or assessment, and in order to help that individual put together a care plan or a follow-up plan. More than once, the previous speakers have talked about the nature of the progressive disease that we're dealing with. So we know what's going to happen, and so there's such a key to the process of care consultation about helping people first understand and get educated about Alzheimer's disease or other types of dementia. Understand what the impact of that will be on their cognitive health and abilities, and then help them begin to anticipate what they need to put in place to avoid the critical incidents, avoid the crises. So a very obvious area is in the realm of advanced care planning or advanced directives, other legal and financial planning, how to pay for care, how to anticipate that. Safety assessment, safety services. 2/3 of folks with Alzheimer's disease will wander. And so there are a number of safety programs that we offer. Medic Alert Safe Return Program, which is the bracelet, but also the national network. There's also a GPS monitoring service called Comfort Zone. But a big part of that is educating family members to what to expect. And as Dr. Singer and others have talked about, this is often not a straight line in terms of the onset or progression of symptoms. It's very variable. So there may be, particularly with MCI or early stage of disease, some inferences or early symptoms, but then there may not be any obvious kind of change for a while. So we want to help people put in place those resources and a safety net to be prepared for those kinds of changes. Information referral care consultation is free and it's ongoing. So it's not unusual for us to work with someone in early stage, or even if they're just a little worried about their memory, and they may call back a little bit later when they've gotten a diagnosis and they need a little bit more assistance a little bit later when maybe the driving issue comes up or other kinds of circumstances. And we're there continually for however long that person needs our support. Early stage programs are a growing and developing service line or program, if you will. These are activities and programs for people who are living in early stage. And the purpose of that is to be able to get together, gather together, to have fun and connect, similar to the Memory Cafe concept. And it's really no more than that, except that there is some awareness that these are folks in early stage, and that we want to make sure they're aware of resources that are available to them when they need us. We provide lots of education programs. I mentioned education more than once. Not unusual, and I'll use the same circumstance. Liz mentioned the sort of out-of-state or long-distance caregivers. It's not unusual. I'm sure you've seen it where you have a differing opinion or conflict within the family about what they are seeing. Is this normal aging? Is this a disease process? And part of the role of care consultation is to help connect family members, whether they're in Maine or not, over a toll-free conference call line, and begin that education, begin the chance to give them an opportunity to talk about what their concerns are and find some common ground around what changes they're seeing, and then build from there. And that takes time. That takes a process. But part of that outcome could be referring people to educational programs. Lots of programs online for e-learning opportunities. More and more folks are using the website the website for online learning. But in the community, we provide lots of programs like Know the 10 Signs, Early Detection Matters. The basics, Alzheimer's disease, dementia, and memory loss. Living with Alzheimer's series, Driving, When Is It Time to Give Up the Keys. 3 brand new programs, Healthy Habits for a Healthier You, Dealing with Dementia-Related Behaviors, and Effective Communication Strategies. Those programs are free, and we get invited through all across the state to either directly provide those programs or collaborate with other folks to present those programs. So if you're interested in learning about how to host one of those or work with us, we'd be happy to do that. I mentioned the online community. There's a wonderful online message board called ALZ Connected, ALZ Connected. It's a free service. And it allows folks either living with dementia or their caregivers to go online and see what other people are talking about and posting. Gives them the chance to post a question or an issue. For instance, the question came up before about how direct to be about a diagnosis. Very common question and concern. That would be a very relevant thing to post. Should I tell my should my doctor tell my husband or wife that he or she has Alzheimer's disease? Should I tell them what just how direct should we be? And they'll get lots of responses from that. So those are good examples of frequent kinds of questions that come up. And I mentioned our safety services. I'll talk just briefly about our clinical trials. One of our services is called Trial Match, in which we list all of the clinical trials across the country. These are trials that are listed on NIH.gov, but oftentimes, particularly in local areas, we become aware a little bit more quickly than NIH. So a lot of the trials are posted on Trial Match. But the service is very easy. It allows people to go online, take a short survey, and then get matched to a trial across the country. Of course, there are lots of trials. There are drug trials. Dr. Singer mentioned that. And there are early detection trials. There are brain imaging trials. There are psychosocial trials. 2/3 of caregivers will experience significant depression. And so there's lots of research around that as well. The Alzheimer's Association is the largest nonprofit entity that supports research behind the NIH in the country of China. So the Alzheimer's Association provides research dollars across the whole spectrum. Dr. Singer had referred to the Pittsburgh beta amyloid imaging studies. That study was funded in part by the Alzheimer's Association, so there's a lot of that kind of stuff going around and in place. And I'll just finish, and then we can take questions by giving you the local number, but also the 800 number. And I'll just finish with sort of reinforcing my message that the Alzheimer's Association role is to provide support for people living with dementia, people, caregivers, but also people caring for people with dementia and providing support for you in primary care practices or in hospitals or any setting by providing state-of-the-art knowledge, expertise, and support. So I'll stop there and welcome any questions that you have for all three of us. So the question was, how often do we work with primary care practices to help patients and families navigate the system? I'll let Liz kind of answer. We do a lot of outreach to physician practices. The 800 number, that connection is sort of the best way to collaborate. So if it's an easy handoff to say, if you need some help, call this number, and we'll help to provide the navigation, which includes connecting with one of the AAAs around the whole array of services and to collaborate on that. So we're happy to send literature out to your offices or consult around any of that. We're not doing direct, we don't provide any of the services that the AAAs do as far as Meals on Wheels or those kinds of things. So it's a complementary relationship. So